This episode of Crosscut Talks is supported by Alaska Airlines.
Hey, welcome to Crosscut Talks. I'm Mark Baumgarten, the managing editor at Crosscut. And today we're talking about the pandemic and the importance of information at a time of great uncertainty. This might not seem like a major issue right now. In many ways, we're swimming in information about COVID-19. As I noted in our last episode about the state of the healthcare system right now, the COVID-19 dashboard has become a fixture of life for so many Americans. Of course, there is a lot of information that we're lacking right now that would be valuable in the fight against the virus. But compared to the early days of the pandemic, we're in a completely different world. That old world, the one where much of the public and our leadership was desperately seeking information on this new threat, that is where this week's guest found a greater purpose. Trevor Bedford is a scientist, a professor actually, in the Vaccine and Infectious Disease Division of the Fred Hutchinson Cancer Center here in Seattle. Which means that, he was busy in the early days of the pandemic. But he did find time for a kind of side hustle, sharing information about the novel coronavirus on his Twitter feed. He became a must-follow for anyone seeking the latest on the virus. But Bedford wasn't just sharing his considerable knowledge on the virus. He was also helping to aggregate data on the virus and show scientists and the science-minded how to use that data through a platform he helped create called NextStrain. 2+ years into the pandemic, Bedford is continuing to do this work, now with more than 400,000 Twitter followers and a MacArthur Genius Grant to his name. The pandemic has changed all of our lives, and it's certainly changed Bedford's. We wanted to know how. So, as part of this year's Crosscut Festival, we had Crosscut reporter Hannah Weinberger talk with Bedford about the last 2 years and how his very particular experience with this difficult period has impacted the way he thinks about his work and the pandemic. I hope you enjoyed the conversation. If you have any feedback, please send it to talks@crosscut.com. Okay, on with the show.
Dr. Bedford, welcome.
Hi, Hannah. Thank you for the introduction.
Absolutely. So, Trevor, if I can call you that, in your first test of science communication for the day, how do you usually describe what you do as a computational virologist to people outside your field in a few sentences?
Oh boy. So most of it is working with viral genome data. So the coronavirus genome has these 30,000 letters. And as it transmits from person to person, little mistakes are made just by the kind of act of that virus replicating. And then you can take nose swabs from people that are sick, sequence the virus out of them, and then use the differences in that genome to reconstruct a family tree of those of how this virus is related, and then use that family tree to understand things about how the virus is spreading, mutations that might be making it spread faster, and kind of a lot of what's actually going on that is maybe hidden to looking at something like case counts or kind of broader data.
Oh my gosh. So I'm really sensitive to typos in my life, but it sounds like for you, they have a special meaning.
Yeah, absolutely.
Absolutely. So did you view platforms like Twitter as public health information services before the pandemic?
So I've been on Twitter, I think I joined in 2009. And that sounds right. And maybe more active since 2011. There's been this thing of science Twitter for forever, and that's actually been a really really nice platform to kind of share papers, share other papers that you're reading, and kind of there's a nice scientific community, and so that was the entirety of my kind of real experience with Twitter in January 2020, and then when things started to kick off, there was like a lot of scientists talking to each other in science Twitter that then kind of ballooned out to a much larger thing after that.
Right. So it sounds like kind of this bubble that's for work, but it exists in this larger platform. So thinking back to early 2020, was your intention to be sharing information with the entire public, or did you stumble into that role?
Yeah, it was absolutely stumbling, and it was also like where you can think of some specific tweets where like there was some early work looking at kind of serial interval and so forth, and so copied a paper there, and then realized that I needed to then explain what serial interval means and so forth, and trying because there were people listening in, and then trying to kind of even if the kind of foremost target might be other scientists of initial and trying to kind of make it fully or as understandable as possible while still keeping things terse to people who aren't kind of professionals.
Right. So, it sounds like you were already there, but there's this whole new set of eyes because of the nature of the moment. And you've been talking shop with other academics and researchers, and you found yourself in a position to share with everyone. Apart from thinking about, in 240 characters or so, communicating, like how else does this change in audience in the Twitter format affect the way you communicate?
hmm Yeah, it's been, it's like, yeah, I've really liked it as basically a blog format and kind of thinking of Twitter as microblog, and can throughout the pandemic, if I'm interested in a particular topic like case reporting rate or something, and I want to look into it, and then it makes something where I can spend a week looking into things, spend a couple hours writing up a Twitter thread about it, share that with the world, but it's like meant for colleagues, meant for the world, and meant for kind of media as well. And then it's something that it's like I feel like comfortable to talk about this thing with others if you want to get in contact.
Right. So noticing that you have this new audience looking at you, what made you want to lean into that role of a kind of pseudo public science communicator?
Mhm. Yeah. So it was mostly, especially early on, of just how terrible the information kind of ecosystem was, where we have like snake flu and things like this
Oh, no.
that are circulating widely, and so the first bite of this was the HIV inserts preprint that was uh, kind of fairly poorly done, and but then was immediately circulating widely, and so then kind of felt need to respond to that and kind of show like why this is flawed, and then that immediately kind of was more popular than other things that I was tweeting about at the time, and so that's then stayed since then of like trying to like generally the information ecosystem has improved since January 2020, but it's still like um, there's huge amounts of questions that everyone has about BA.2.12.1, and then you can try to like dig into papers in medRxiv or whatever, but it's helpful to have scientists actually kind of giving some summary of what they think is going on.
Right, especially scientists who really appreciate how quickly things can develop and spread and take ownership of the conversation like viruses do.
Hmm.
So you have access to a lot of information that people want. How do you decide what to share?
Yeah, so there's like it's a combination of things that I'm interested in. So I mentioned the case reporting rate as something that I was like curious to dig into for a week, and then other things that are like um, in the media, or particularly I'm getting repeated emails from NIH CDC reporters or whatever on BA.2.12.1, and so rather than trying to respond in detail to everyone. Instead, it's more efficient to make a thread and kind of have that be shared.
Wow. So um, You mostly have been speaking with researchers before all of this. Who is
Hmm.
the audience that you want, and who is the audience that you think you have?
Yeah, I think that that the audience that I want and maybe think I have are people that they they for most of the things that I'm writing, they probably need a bachelor's in biology sort of thing. I'm not. It's it's too hard to talk about things like, well, antigenic drift and so forth. If I were to try to make it for everyone, it would balloon out where you'd have to write essays to kind of explain actually what's going on, and I haven't felt like I could commit that level of time, and that would probably be better for a blog than Twitter anyway.
I don't know. I
Um,
see you going
yeah,
on TikTok with whatever's in your kitchen and being like, today we're going to do antigenetic drift, or
yeah, yeah.
yeah, maybe later.
Maybe later. And so yeah, and then so then relying on it to be concise and as accurate as possible with the which scientific jargon helps with, and then kind of that can get picked up by reporters and explained, or by others and explained more, and not trying to do the as broad of science communication as you might imagine.
Did you see yourself in that role immediately, or have you been trying to toe the line between sharing information that's scientifically accurate but not so jargony that people haven't found it useful?
Yeah, yeah, I think it's like it I would, if the Twitter following was smaller and like still the scientists, that would be easy to just be completely in the on the jargon side of things, have tried to make things more accessible, with the kind of as the um, as the following increased. Um, and I do pay attention. It is helpful having people responding, and I can see kind of where it didn't line up, and where the point that I was trying to make maybe was not caught by a number of people, and then we'll adjust.
Really? Does anything come to mind?
Um, that's gonna be hard. Like, yeah, throughout there's a number of things like throughout of like infections versus cases, and trying to kind of make it very clear to people that when we talk about cases, we're not talking about all the infections that are happening, and so forth. And so there's like then language to be very careful with there, in terms of what's actually happening.
Right, right. I covered this for a year and a half, and I still catch myself calling the virus COVID. So I totally appreciate that. You have to be really sensitive when you're talking to people who haven't been in school for as many years as you and spending their time tracking this kind of stuff. And you touched on this a little bit, but there's a lot of misinformation on the internet. Does the foreknowledge that what you share may get contextualized in a way that you are maybe nervous about affect the way that you communicate with the public or people in public health or policy?
Yeah, this is a huge issue for the pandemic, um, where I've ended up, uh, like at the very yeah. Let's start from the beginning. So in early 2020, I, like others, I was. It felt like the CDC or the WHO should be the one like raising this huge alarm, and that it's not the like individual scientist role to say like this is there this pandemic is coming. um, but then it seemed like their CDC, WHO at all were overly concerned about a like scaring people when people should have been scared, and that might then reflect on how comms has been done by public health since then, where like it's been there's been a like always trying to think two steps ahead of like we want people to to wear masks, so we're going to talk about how good we're not going to talk about how much better N95s are than cloth masks because we were afraid that not everyone could get N95s. And then that like rather than just being just completely on it with the scientific accuracy. And so with what I've done is trying to be fully scientifically accurate, trying not to think two steps ahead. Though it has meant that for things that I'm not fully kind of an expert in, that I will tend not to engage in that side of it because I don't feel confident in that topic. But yeah, on things that I am confident in, of just going with the only thinking of accuracy rather than thinking about the comms.
If only more of us didn't weigh in on things we didn't understand sometimes. So it sounds like, does this make you think about the value of transparency?
So yeah, and this is hugely important through the pandemic, and that that having scientists be just acting in their role as scientists and trying to and also having things be this well, yeah, let's take a step back. Where like it's felt way better to have the analyses that we're doing up for the world on nexttrain.org, where then I can point fellow scientists to, but other people can, are welcome to look at it. It gets, there's a number of people that will be confused, but that's okay. It's good that the information is there. And the same thing with kind of the maybe the public health reporting, where where it's been better to write to rather than having a reporting chain up to local, state, national public health, that it's technical reports or whatever, and then that's only seen by this small group of people. Easier to post things on Twitter, and then kind of then share that with these groups. That way things aren't gated.
Right. So kind of a collective learning experience, and realizing that having the information out there, regardless of everyone's level of science literacy, will help move the ball forward. And hopefully people will find people who can answer their questions.
Yeah. It's been much easier and better to have things be as public as possible. And then, even if the intended audience is not the entire public.
Right. And so you have all this information out there now. What kind of responses do you usually get?
So it's, in terms of Twitter posting a new thing, that it's the normal, I think, issue with the platform, and probably any of these social media platforms, where you can get 1,000 likes, but the things that you notice are there's the recent post about BA.2.12.1, where we have half of people saying that I'm minimizing long COVID, and I'm minimizing by saying it has flu-like drift, that it's comparing to flu, and then that's going, that's horrible, and how could you do this? And the other half saying COVID is over, or why are you trying to scare us? You are fear mongering. And so there's if things are at a pretty good place, I have a roughly equal number of people shouting at me from one side and from the other side.
Have you ever regretted engaging with the public?
No, I think the regret might just be, now there's this freighted with responsibility to keep things up, and to do a good job with this, but not the actual act.
Right. And I want to talk with you a little bit about information sharing in science as well. But before we get there, did you ever expect to be talking about a social media platform with regard to your work this much?
No, definitely not.
No.
I think I would note that yeah that this theme that resulted in nextstrain.org and kind of having something that's public and real time and like we want analyses shared as quickly and openly as possible is the same kind of underlying motivation that is pushing for the kind of Twitter analyses. So that's definitely been there. Yeah, but the like how heavily inflected things are with social media was definitely not expected.
Right. And so, with all of these responses and the public and public health out there, seeing all this information that you're putting out there, does that affect how you think about yourself as a scientist or how you do science?
Yeah, I think that what's been tricky here for everyone is that pandemic has moved so quickly that generally you want to do thorough, accurate science. Peer review really helps with this. But by the time the paper comes out, often the thing that like you really wanted to address is no longer as relevant. And so then we can kind of push towards faster preprints, and that's been I think an actual really good thing for scientific understanding of the pandemic. And then even more than that, if we have something that like is happening today or something that of pushing for something like Twitter or something that's kind of or a technical report that's not even not even to the level of a preprint, but being able to have scientific research happen in a faster pace than what's been kind of the traditional slower but more accurate form of things.
Right. Does putting so much information out there in preprint form, where science is kind of iterating on itself rapidly, do you think that that's affecting how the public understands what science is?
Yeah, I'd hope so. I think that I really didn't like and still don't like the like standard way that things would happen would be for the in terms of public consumption that the uh, scientific process happens, paper bounces back and forth, and peer review, it's hidden away, then it gets published, and then it's attended with a university press release, and then it's reported on from the press release, generally not from the paper, and then it's taken as truth because it's like gone through this process where it often be wrong, quite often be wrong. And now I think people realize how with preprints and all of this that like this reported on finding is not necessarily true, or this particular paper is not necessarily true, and it might I I'm sure it's more confusing for the non-scientists, but that's perhaps like more of a and more of an accurate understanding of actually kind of how scientists are approaching things as well.
Right. It's my job to read your preprints and your papers and not the press release to try to figure out what questions to ask you so I can explain it better.
Yes.
It's not all on you. So, a quick reminder for our audience to make sure to get your questions in the chat section because we will be asking some of them soon. But before then, getting to your scientific work, Next Strain has accomplished some incredible stuff. How has the pandemic changed the way that you view open data's role in the future of medicine?
hmm Yeah, I think that the genomic sequence data, there's been a real push here in the last 5-ish years that has been pretty remarkable of going from um, back, and I think like the inflection point was really the West African Ebola epidemic, uh, whereas before that, the standard practice would be there'd be an outbreak, there'd be samples collected, things it was too hard to do the sequencing in real time enough to actually inform understanding of the outbreak, and instead you'd end up with a paper a year after the outbreak happened, and then you'd release the sequence data then. and then with Ebola and Zika, and then very much with COVID, kind of a push to just share the sequence data immediately. And this has been, and then it's allowed things like NextRain, but then we have a bunch of other endeavors like CoVspectrum and covariance and outbreak.info and so forth that are relying on data that are shared very generously by producers all over the world, curated by folks at GISAID and NCBI, and really, like, there's a fantastic ecosystem here now. Part of what's worked well with that is, like, each viral genome is this very kind of granular thing that like you have those 30,000 letters and you have some very obvious metadata to attach to it of when it was collected and where it was collected. So it makes kind of pooling that information pretty straightforward, in a way that if you were to have other scientific data, it's not often as easy to do that pooling from a bunch of different groups. And
Right.
so,
And this is because we've been sticking stuff up our nose for a couple of years that we're able to get this.
yeah,
Yeah.
yeah, and the variant, legitimate worry about the variants kind of really pushed things as well. Where in 2020 there was pretty good sequence data, but it wasn't at all like it became in 2021 when we had the variants of concern emerge, and then each country started really, countries across the world started really funding the sequencing efforts.
Right. And so on that note, you have, proof of concept for why this kind of surveillance can be really helpful. At the same time, while we're reading news articles about BA.4, BA.5, we're kind of reeling back a lot of the surveillance and tracing that we've been doing the past few years. What are we still missing when it comes to the data collection we do to keep tabs on the virus in the US? Like, can we improve?
Yeah. So throughout pandemic, but especially in kind of this genomic side, we've really relied heavily on UK and Denmark, probably more than in terms of the actual kind of connection to epidemiology. South Africa has been amazing with the kind of early warnings and detection. The US is doing a really good job sequencing. Kind of, we have as much sequencing as anyone, but because the way the US public health system works, it's really hard to take that nasal swab that was this confirmed case and actually connect it back to, like, knowing their vaccination history and even knowing their age, or even knowing if it was a hospitalized case or they may have died later. And because of how fractured the healthcare system is, you can't do these large-scale analyses in the U.S. the way that you can in, say, the U.K., where they have everything connected because of their health system, and so that's made it hard to know things specifically for the U.S. Like right now is BA.2.12.1 that's spreading quite rapidly. Is that spreading because people are getting reinfected that were infected in the initial Omicron wave with BA.1, or is it due to intrinsic transmissibility increase, and the people that are largely getting BA.2.12.1 were other people that weren't getting infected and that didn't get infected in the initial Omicron wave?
Right. So if you manage to socially distance, we're talking about transmissibility, maybe you're still susceptible because you don't have the antibodies that you need right now. So could we do this improved surveillance? Like, what would we need to get there?
Yeah, the strategies that have worked in the U.S., I think getting something at a national scale is probably impossible at the moment. The strategies that work at a smaller scale are kind of state level or jurisdictional, kind of county level, where you can a confirmed case is reported to public health, say to Washington Department of Health, and then they're able to connect it up to the sequencing that's happening in the state at Washington Public Health Labs, but also at University of Washington. And the WADUH then has a database that actually has that connection, and it's a lot of work on their part to get that happening. And the other way that I've seen this is through like Kaiser Permanente in California has some really good papers where having the HMO where they have kind of all of the data, they can actually connect things as well.
So locally, we're doing okay, it sounds like.
Yeah, Washington is in a really good place with all the genomic surveillance side.
Right. Given that, though, where we are right now, what ideas or concerns are you most interested in communicating to people?
Interesting. I think that what's really going to be important and will take a lot of work to figure out is kind of why are people immunologically, why are people getting reinfected? And the virus is going to keep evolving. It's going to be like flu, where people are going to get infected every couple of years, every year, something quite common. And as those reinfections occur, your immune system builds up kind of more and more antibodies that target different parts of the virus and different forms of the virus. And we want to get through booster doses or vaccination, kind of improved vaccination platforms, a way to make a really broad, durable immune response that kind of keeps the virus from being able to run away from it so easily. And we've there have been pushes for a universal flu vaccine, which you may have heard that term before, because this was the thing with flu for decades, and so it will still then be a real push for COVID to have vaccination that is more robust to evolution.
So can we make those vaccines fast enough to meet the sequencing data?
So there is a strategy that is probably what we'll end up with in the short term. That isn't a bad strategy, where we have enough sequencing data. You can kind of know that, well, right now things are this version of Omicron. So then Moderna, Pfizer should start kind of swap the vaccines to that and then deploy those in September, October. And we can do that basically every year with a May, June sort of decision for a fall vaccination campaign. And that should match pretty well. But it won't always match perfectly if something is emerging over the summer or if you have multiple circulating things. And so, yeah, ideally, but it's more difficult, you'd figure out some way to have multivalent vaccines that kind of include different versions, different forms of the virus, different forms of that would give you kind of a broader immune response that would be more robust to the ongoing evolution. And that's more of a challenge, but it's something that I'm sure the field will be working on.
Right. So it sounds kind of like, if I were to try to find an analogy in my own life, when I go outside in Seattle, I wear lots of layers because I don't really quite know what the weather's going to be. So I have to be prepared for anything. All right.
Yeah, that's fair.
Okay. What does it feel like when people ask you what's going to happen next?
Yeah. I try not to gate the information where I'm happy to talk about what I think is might be happening. It is like being freighted with this responsibility to kind of know what's happening. And I've definitely been wrong. I don't know. I don't have a great answer there.
No. It's great. I mean, obviously, this is something that you really think about. There's a lot of responsibility here. And do people seem to expect you to say things with certainty?
Oh, no, I don't think so. But I think they definitely expect an answer. Yeah. And I think that conveying proper levels of uncertainty is one of the kind of more difficult things in any of the scientific communication between scientists, scientific communication out to the public. where that side of things is just so difficult to get right, even if you can kind of be in the right direction of like how confident are you in this this particular finding or this particular forecast.
Right. And that's not what people want to hear in a crisis, but hopefully this might build up our resilience to learning in the middle of a information vacuum. So now, because I have to ask, what's next?
I think we touched on that a bit earlier, where like I think the general pattern will be something that's a little like flu, where COVID evolves really quickly, or SARS-CoV-2 evolves really quickly, and like so far, if we look at it in terms of its sequence evolution and the part of the virus that really matters here, and spike protein, it's evolving about twice as fast as the fastest seasonal flu virus. It is significantly more intrinsically transmissible. So a flu infection where no one has immunity would probably infect 2 additional people, whereas a SARS-CoV-2 infection where no one has immunity at this point would infect 6-ish other people. And so those 2 things combined will just mean that COVID circulates more than flu every year. However, with immunity that we have, the infection fatality rate, the proportion of people who die from infection, is actually pretty comparable to seasonal flu at this point. So we have a situation where we can expect lots of COVID circulating at a individual infections are likely to be mild and are probably not so harmful generally, but there's enough infections happening that it will be a kind of a major source of mortality and morbidity across the population every winter.
We'll be back with more after this message.
Dreaming of a long-awaited vacation? Take your travels to the next level with Alaska Airlines. They're committed to providing a higher standard of safety and cleanliness throughout your journey. From mask requirements and touch-free options to HEPA filters on board and fresh air every 2 to 3 minutes. Plus, their award-winning loyalty program, Mileage Plan, makes it easy to earn and redeem miles wherever you go, including destinations worldwide, thanks to their One World Alliance membership. If you're ready to land a low fare, next-level care, and the best experience in the air, book now at alaskaair.com.
Before we run out of time, I want to get to some audience questions. What's an example of something you've learned to communicate in a way that makes more sense to non-scientists or people outside your field?
Oh man, I don't have a good answer there. I think the like simple thing that I started with of thinking about these typos, these mutations, and as being able to understand a family tree, and using that analogy of family tree has really been helpful, as opposed to like the initial push for more technical terms of like phylogeny or something like this. That it's talking about this as like ancestry of the virus seems to make sense.
Interesting. Who do you follow on Twitter that you think does a good job explaining the virus that regular folks might understand?
Yeah, I think that maybe to answer this very obliquely, that my favorite Twitter follow is definitely Zenep, where she and there's a couple other people like Michael Lynn that have generally been just okay thinking for themselves, and then if they have something that they believe that does not fit the kind of primary narrative about, say, aerosol transmission or whatever it is, that they're okay being loud about it. And then also, like, she's been right, even with these things that are not necessarily always agreed on. And so people that are okay being fairly outspoken, but also have a history of being correct about these things.
Right. So this next question relates to something you and I have chatted about a little bit before. Is there a point where this extra job of communication becomes a distraction from your quote unquote real job?
Yeah. So it definitely depends on like what you're trying to accomplish. Where the main thing that scientists are usually judged on, and the thing that you're usually trying to do to push forward science, is to write papers and to get a paper through peer review and then have that as part of the literature. And through the pandemic, I think early on that that things were moving so quickly and the information vacuum was so intense that definitely the best thing to do was to be focusing on more of the media engagement and Twitter and so forth, and trying to kind of help everyone understand what's going on. But then as things have become less of a crisis, it's pushed me to like focus more on the paper side of things and do less on Twitter. And I can imagine that as a kind of as a general thing, that that there's real importance to having the kind of rigorous, accurate, peer-reviewed science happen, and that kind of that you need enough of both to actually be useful here. And as things hopefully continue to become less of a crisis, we can kind of push more towards the paper side of things.
Right. So it sounds like you kind of schedule your scientific life aligned with how crisisy things are.
Yes.
Absolutely.
Very much so.
Another audience question is, have you experienced pushback from fellow scientists, and in what ways?
Yeah. I think that so the fairly long story. So the early on in February 2020, when we had the initial sequencing that we were doing with Seattle Flu Study of viruses in Washington State and in Seattle, that we kind of managed to do that sequencing before pretty much kind of anyone else was in the country. Discover this WA2 virus and this community case, and then that from the mutations, it looked very much like it was directly descended from WA1, and the kind of the simple statistical analysis had it as a 3% chance of this genomic resemblance being possible if they were kind of independent introductions. So then I had the tweet saying that we have had cryptic transmission for the last 6 weeks. That goes very far, and that turned out, I'm pretty certain at this point, to be wrong. That it was a second introduction, and that it was that 3% chance that happened. And I still think it was the right call to make even just from an accuracy perspective. But when that paper was getting peer reviewed, one of the reviewers was very very adamant that it was completely inappropriate to be announcing this over Twitter in a quote freewheeling Twitter thread. And so so I think that that there was, and I'm sure there still is, kind of a number of scientists who would prefer things to not, to be like, and it is a spectrum where you'd like things to be more accurate and like things to be more, like it's a real trade-off between being more accurate and being fast. And I think with all Twitter and all of this, I've been more on the fast side and have been wrong because of that on occasions.
Right. But this is a kind of applied literature, right? You've noted that it's important to publish papers for the scientific literature, but for it to make an impact, sometimes this communication really matters. And it looks like we have run out of time. Trevor, thank you so much for all the work you're doing to make information transparent, for helping translate some complex stuff in ways that really benefit the rest of us. There's one audience question that I think would be a great way to sign off. For someone who does not use Twitter to get information, how can people follow your research in real time if they're also maybe not someone who would use NextStrain?
That's a really good question. I'm thinking of, there's not an obvious, like there's a lot of, if you're in this, like the weeds of this variant side of things, there'll be all of these things like Cove spectrum and Cove variants and like GitHub discussion board to talk about labeling the next Pango lineage and all of these things. And then like there's not like an obvious, I wish there was, but there's not an obvious like go to this website and you'll get a kind of a layperson friendly description of what's happening with the evolution of SARS-CoV-2. I think this is then fairly biased. I have a couple of talks on my website at bedford.io. If you go to the talk section, that especially recent BBI talk that posted to YouTube, that will kind of give a fairly broad overview of what's going on.
Is that Brotman Beatty Institute?
Yeah.
Great.
Yes.
Yeah. Excellent. Thank you so much, Trevor.
Absolutely.
And that's it for today's episode. Thanks again to Trevor and Hannah for the talk, and thanks also to the folks in the audience who asked questions. If you'd like to be one of those audience members for a future Crosscut event, go to crosscut.com/events. This episode of Crosscut Talks was produced by Sarah Bernard and engineered by Resti Bagcal and Viktoria Ralph, and the event was produced by Jake Newman and Andrea O'Meara. Ann Krisnovich managed our audience engagement. You can subscribe to Crosscut Talks wherever you listen, and if you like the show, please review us. It helps other people find us. For the latest political, environmental, and culture news from the Pacific Northwest, visit crosscut.com. And if you would like to support the work that we do at Crosscut, whether it's the live events we host every month or the in-depth reporting we deliver every day, go to crosscut.com/membership. In addition to supporting our journalism, members receive complete access to the on-demand programming of Seattle's PBS station, KCTS 9. Crosscut Talks is a product of Cascade Public Media. I'm Mark Baumgarten. We'll be back soon with another conversation.